Dr. Elliot, is the flu shot important for everyone?
Well, not everyone needs to get the flu shot. Certainly, almost anyone can get the flu shot if you're over age 6 months, if you don't have an allergy to eggs or chicken, and if you've not ever had a previous reaction to the flu shot, you're eligible to get it. There are certainly certain groups of people that should get the flu shot. Currently, the recommendations are that all children between age 6 months and 5 years get the flu shot. There's also a recommendation that anyone over age 50 get the flu shot. People with certain health conditions are also recommended if you have respiratory disease, and that could be things like asthma, emphysema, chronic bronchitis. People who have diabetes should get the flu shot. People who have a history of heart conditions should get the flu shot. People who have a suppressed immune system, whether that's from a certain illness or perhaps people who have certain types of cancer where they might be getting chemotherapy that suppresses their immune system, they should get the flu shot. Also, people who interact with the public a lot, people who are in healthcare, people who are residents or working at a nursing home, people who are caregivers of children under age 5, or people who are caregivers of someone who is at risk should also consider getting the flu shot. But certainly the flu shot is available to anybody. So you don't have to have one of those conditions to get the flu shot. But if you're at high risk, you should definitely consider getting in and getting your flu shot. So generally from year to year, there are 20 to 30 million cases of flu in the United States. There are roughly 35 to 36,000 deaths in the United States annually as a result of the flu. And the people who are recommended to definitely get the flu shot are more likely or more susceptible to the complications of the flu. Sinus infections can result. Pneumonia is a serious complication of the flu. A brain infection called encephalitis is a serious complication of the flu. So people who have the special recommendations to get the flu shot are really more susceptible to developing the complications of the flu. And again, while there's 20 to 30 million cases, there are roughly 35 to 36,000 deaths every year directly as a result of the flu. So not only is it a bad infection from the standpoint of high fever, cough, sore throat, extreme fatigue, muscle and body aches, but there are some serious complications and it can be fatal in some people.
Dr. Elliot, Mrs. Claus, the elves, and I have never had the flu because it's so cold at the North Pole. But is it still important that we get a flu shot?
Well, Santa, you look kind of old, so you should definitely get a flu shot.